So the pre-cut pads are applied to the areas where I know that I'm going to need to mould to achieve and hold a reduction of the fracture. So at and just below the level of the lateral malleolus, and at and just above the level of the medial malleolus, so that I can apply pressure and counter pressure. The rest of the padding is placed in areas where I know that there is going to be either a bony prominence, or the patient is going to rest their leg and the weight is naturally going to give pressure. So over the heel and up over the Achilles tendon, snug that on to protect the common peroneal nerve at the level of the fibular head and fibular neck. Around the metatarsal heads, unless you're lucky, this one needs to be cut quite often to stop it overlapping. I'm lucky, that doesn't need to be done. And then along the tibial crest. Now you don't want it going over the dorsum of the foot into the crease of the ankle there, because it provides a pressure point there. So just avoid that and cut that to length. And then these thinner strips of felt we've been using to make removal of the cast safer and more straightforward. So these will be applied along the lines that you want to put the plaster saw. So down the lateral side of the tibia, so over the anterior compartment. Cut that to length. It doesn't need to overlap at the bottom. And then a shorter piece over the lateral side of the foot, so that the plaster saw can be used in that area as well. I always end up getting that piece far too long. I don't know what size feet I anticipate people are going to have. So try and get rid of ruckles now. Make sure I'm in position. I often check the x-ray at this point just to make sure I'm going to push in the right direction. I'm happy that I can achieve the reduction that I want. On the image intensifier, the position is satisfactory, and now we're ready to apply, cast and mould. Having put the padding in place, the final layer is the orthopedic bandage, and this you put on really quite firmly as a single layer, so I'm not aiming to overlap it. And this is just to hold everything in position. Try and keep the ruckles out as much as is possible. And just a single layer. Okay, you're happy now. Have you got, just hold it, make sure you got the toes for me so as I can wrap the, that's good, that's fine. And now to apply the plaster, you can put, if you're going to wear gloves, this is the time to put them on. If you wear them before, they stick to the sticky back felt. So the plaster is not just laid on like you would with a total contact cast. It is wound on. You're just trying to apply a little bit of tension through the padding that you put on so that it conforms. You want it to conform well without applying uneven pressure. So as you are putting it on over padding, you can afford to just apply a small amount of tension. Check that your foot is in plantar grade. Just let it relax a wee bit, that's good. Because if you have to correct it once the plaster's in position, it's naturally going to crease. If it starts to go crooked, get rid of it. And then, now I'm not putting a great thickness of POP on, it's not necessary, because the purpose of this is not to provide the strength, but to provide the close contact nature of the cast. I can give the strength to this construct by a top coat of fiberglass, which can be put on once the position has been achieved and secured. So this is purely to hold position and to make sure that it's well moulded and is close contact. So a final glance at the X-ray to make sure that you're moulding in the right place. You should be moulding over the pads that you've placed. And just wait for it to set. Once it's set, and while you can remember, it's worth using a marker pen just to mark on the outside of the plaster where the cutting strip is that you've placed underneath, because that will facilitate removal.